I am Dr. Philip Akawani, the lead clinician at Banhart Specialist Hospital. A few days ago, we received a call from a client at home who had suffered a fall whilst using the stairs and was in severe pain and unable to walk. Our emergency team was quickly mobilized and the patient was safely brought to the accident and emergency for further assessment and management. After a brief history and physical examination, an urgent pelvic X-ray was requested, which revealed the patient had suffered a fracture of the left femoral neck. The orthopedic team, led by a seasoned consultant orthopedic surgeon, was contacted, and upon further examination, a pelvic CT scan, which was also done, confirmed same. The clinical decision in the best interest of the patient was a total hip replacement surgery. And after the consent of the patient was obtained, pre-op preparations for the procedure was commenced.
My name is Dr. Vincent Ativo. I'm a consultant orthopedic surgeon and a senior lecturer at the medical school. And I am also a trainer for surgeons for the Ghana College of Physicians and Surgeons, and then also for the West Africa College of Surgeons. I also teach postgraduate nurses specializing in emergency medicine and also orthopedic nursing. I've been practicing as orthopedic surgeon since 2011, where I qualified as a fellow of the Ghana College of Physicians and Surgeons, and also a fellow of the West Africa College of Surgeons. And I did my subspecialization in the United States of America, where I trained at a hospital for special surgery. I also trained at the Otto Carolina Adult Joint Reconstruction Center in Charlotte, North Carolina. I was at University of Utah Orthopedic Center. I was also at the headquarters of the American Academy of Orthopedic Surgery in Chicago. My mission here today is to do joint replacements for a patient who suffered a fracture of the neck of femur some few days ago. This is one of my fields, specialties, and I am here to make sure that I help these patients. Joint replacement surgery is one of the breakthroughs in medicine. It was started some time back in 1850s thereabout, and since then there has been improvement upon improvement to make sure that people's joints that are destroyed by other trauma, other degenerative conditions, infections, and other conditions that destroy joints are restored. So it is a joint restoration. In fact, we replace the joint with artificial prosthesis to help such patients to relieve them of pain and reconstruct the joints for them to be able to use the joints again. I have with me my team of anesthetists, intraoperative nurses, circulatory nurses, pre-operative or perioperative nurses who take care of the patients, and also the intensivists who take care of the patients when the patient is on recovery.
So is the fractured fractured neck of the femur. The femur bone, the biggest bone in the body, the head, the neck has been fractured. This is the way due to the fall, and we have to extract it because if you leave it there, it is a dead bone. There's nothing we can do about it. So to just be there and cause a lot of pain and more degeneration and a disability for the patient. So the best way to go with this is to do to replace the joint and put artificial hip for her, and that's what we just did within an hour. Just to start mobilizing after we've seen the post-op X-rays. And we are satisfied with it. That's the head of the biggest bone in the body, that's the femur. Okay, so we need to put artificial one in this artificial head, just like this, looks like this, and so looks like this. So, but it is made up of titanium and cobalt chrome, titanium and cobalt chrome, with a plastic liner, and that plastic liner is a refined plastic liner that is inserted and that to form the acetabular component. Then you have the femur part. The femur part also looks like this. Femur part also looks like this. This for women, but the femur part also have the shape of this nature. So we slot it into the femur, the thigh bone, and then put the head on it, and then we reduce it into the acetabular component. So you can form a head, the shaft, the head, the neck, and then the head. So after fixing it into the femur bone, this is the acetabular component. The liner into reduce it goes into to form a joint like this in this position. To form a joint in this position, like the original joints. And that's what we mean by a total hip replacement or total hip arthroplasty or artificial hip joint replacement surgery. If this can be in for 20 years or more, it is our hope that if you go out from anesthesia, we do to monitor the vital signs if it's okay. Then you can request for X-rays after the surgery. After the surgery, call that post-op X-ray. When we are satisfied with it, then we can have physiotherapists to mobilize the head using a walking aid, in it Zimmer frame or crutches, can be elbow crutches or articular crutches. Don't have one here to push heavy weights the limb for now, because when the healing the mental in the bone must take place to be fed and to be painless, because you'll be able to mobilize fully. It's safe now, and the joint is safe now. And monitor head. So the next 3 to 6 months. That's it. So from 3 to 6 months, you should be able to really mobilize without the use of any walking. And the pain is going to go away completely. Like I said earlier on, joint replacement is one of the breakthroughs in modern medicine, and our patients
in the sub-region, the West Africa sub-region, or in Africa, or the low and middle income countries must also benefit from this major surgical procedure. The problem, the challenge we have is that patients find it difficult to afford to pay for the total joint replacement.
So I'm Dr. Samuel Dukante, a specialist anesthesiologist, part of the team that conducted the surgery, the just ended surgery. So pre-op, we'd done some assessment for her. She looked fine. She was stable for the surgery, and she was passed anesthetically for it. Intra-op, we envisaged we may have a bit of a difficult airway, but it didn't happen that way. It went very smooth, and the anesthesia was quiet throughout. We didn't have a lot of challenges. We just had some problems with her blood pressure, but that was handled very well. Post-op, we've woken her up, and she's conscious and then recovering well. In recovery, our main concerns are continuing with analgesia, that's the pain medications that she's going to get, and then managing her blood pressure. She's somebody who has, normally she has very low blood pressure, so we're just keeping an extra eye on that. Aside that, everything has been fine. It's been throughout.
Call on the public and individuals who are in very good position to assist the hospital run to deliver the needed services to save life in this community and beyond, to patronize the hospital and lend their hand in the running of this hospital. We hope that this will mark the beginning of a new dawn, so that major surgeries, including joint replacement surgeries, arthroscopy and ligament reconstruction surgeries, limb reconstruction surgeries, and management of complex musculoskeletal injuries can successfully be done in this hospital. And we are grateful for everybody's contribution towards that.